My name is Arvind Kendurkar. I'm currently working as a senior staff specialist with the Drug and Alcohol Services. I'm currently working in the opiate treatment program at Newcastle, based at 670 Hunter Street. So that's my current designation. So I've been working with Drug and Alcohol Services formally since 2018, but I have worked previously with Drug and Alcohol Services since 2013, so more than 10 years now. So that was a big part of my career progression. I would say transitioning from mental health, I'm a psychiatrist by training, into addictions psychiatry and then addiction medicine, and then with the better career prospects, education support. So I decided to move to drug and alcohol in 2018, and here we are. Before moving to drug and alcohol, I was working as a staff specialist with the mental health services within Hunter, New England. So I was previously employed in Tarim in the Manning region. Then there was an opportunity to work within the mental health and substance use services, which is a dual diagnosis unit based at Martyr. So I moved to Martyr in somewhere around 2012. Then I got interested in the field of addiction, so I decided to do the addiction psychiatry training. So as a part of the training, the mental health was not accredited at the time, so I had to work out a plan for training. So essentially I carved out a training for myself as an addiction psychiatrist involving the drug and alcohol. I must say that the support from drug and alcohol services has been enormous. So the moment I requested from the support, and then I started my training as addiction psychiatrist, so I was based at Martyr, but I used to come here with drug and alcohol services few days a week to complete my training. So I did the training working with the mental health, and after completion of my psychiatry certificate, then I was offered to whether I would like to do an addiction medicine fellowship, which is another additional training as a part of through the College of Physicians, which is different to the College of Psychiatrists, which means that I'm a dual fellow. So at the time, Dr. Sally McKenna and Craig Sadler, they both were available for me to supervise, and that worked out really well with the ongoing clinical support which I had, the clinical supervision, the one-to-one individual supervision, the assessments process. They supported me every step of the way, and then I got my fellowship in 2017 by memory, and in 2018 there was an opportunity which came up in drug and alcohol, so I decided to move on. So since my move in 2018, I would say that my career progression has not stopped. I've continued to progress, and I'm also working a little bit in the field of medicine. So Professor Dunlap, as I say, he is incredibly supportive. So he's never stopped me from training, so I keep studying. So, and I'm doing my PhD as well, with him being one of my co-supervisors. So there we go. We keep going. Since moving to DACS in 2018, so I have had the opportunity to rotate around drug and alcohol services. So I would say that I have worked around almost all the sites within Newcastle, which is very fortunate to get an exposure of different teams, how different team dynamics works, what are the client network works, what support services. So before moving to the opioid treatment program completely, I worked with the assertive community management team, which is a high risk community support team. Absolutely encourage anyone to apply. So definitely would be open to talk to any health staff in any discipline if they were interested to work within drug and alcohol services. But specifically being a health professional, medical professional myself, definitely would be happy to support any medical staff who would like to look at their career within the drug and alcohol services. So I regularly give my lectures to GMOs, registrars, as well as psychiatrists. So and definitely happy to talk about how to get into drug and alcohol services. If anyone is thinking about drug and alcohol, but you are worried about what, if, how, and what sort of client exposure to have, come and talk to any of us. We are more than welcome to show you around, show you how the client exposure works. It's a straightforward service, just like follows the model of any treatment model which we have in the field of medicine. And I must say that because we are able to integrate and hold on to individuals for a longer period of time, the results what we get is pretty outstanding. You'll be surprised to see those results, and 100% job satisfaction guaranteed, I would say. You don't have to be formally trained to begin with the services. We can train you up. We have full-fledged training program for medical team, plus excellent supervision support. And I must say, I'm also the chair of the training committee of College of Physicians. So I do accreditation across Australia and New Zealand. So Hunter New England is one of the very few sites which has all the services at one site. There are only very few which you can count on the fingertips which they are available.